Hi, y'all. I'm Emily. I am a third year medical student at California Health Sciences University College of Osteopathic Medicine, and I'm this year's SAOAO Pacific Region representative. Today, I'm going to be giving you an example of how to present a journal article to a journal club. Now, feel free to change this up however you feel comfortable, but this is just generally how I usually do it. So, I will be presenting on a paper from the Hand Journal on conventional versus 3D printed cast wear comfort. Okay, so some background. Casts have been used for immobilizing fractures and ensuring proper healing, but the main issue with a lot of fiberglass casting is that it's very uncomfortable for the patient. There's poor ventilation, it's not washable and breathable, and it tends to be very heavy. Recently, 3D printed technology have allowed for 3D printed casting to serve as an alternate to fiberglass casting. Now, 3D printed casting tends to be more customizable because you can print it however you want. It's much more affordable because the materials are a lot cheaper. It's waterproof because it's kind of a plastic material. Many studies have shown it is biomechanically sound, but the jury is still out on how this does clinically. So, this paper is taking a look at how at patient satisfaction in a clinical setting. So, as I said, this research evaluates whether 3D printed casts would improve wear comfort and functionality in 3D printed versus conventional fiberglass casting, specifically for the upper extremity. They hypothesized that there would be similar wear attributes and functional outcomes between the fiberglass cast and the 3D printed cast groups. So let's talk about their methods. So this is a functional wear and safety trial. So not like an official blinded randomized control trial. It was unblinded, and they recruited 12 healthy volunteers. It was 7 women and 5 men. They were all right-handed, and each volunteer was fitted with a 3D printed cast and a fiberglass cast in separate 2-hour sessions so that they would be able to directly compare the two types of casts. So for the 3D printed cast, the participants' limbs were digitized using an optical scanner, which was kind of a quick 3-minute long process. The scanned file was then digitally processed and then printed. And this is figure 1 detailing those steps from the paper. So for outcome measures, they had 3 main ones. For functionality, hand function and dexterity, the Jepson hand function test was used. And this test was administered by an unblinded certified hand therapist. More on that in the next few slides. And then for patient-reported outcomes, a modified version of the patient-rated wrist evaluation was used to measure patient satisfaction and perceived function. And then skin issues were recorded to evaluate the comfort and safety of the cast. This includes pressure, scrapes, scratches, abrasions, and any friction after wearing both casts. And then statistical analysis was performed using a paired student t-test to evaluate for differences in task performance and functional questionnaire, with the p-value being significant at less than 0.05. So for the Jepson hand function test, it measured performance time for functional everyday tasks using both weighted and non-weighted items, and then compared those times between the conventional cast and the 3D printed cast. And this is just an example of the test from a different paper, just for a visual. Then the modified patient-rated wrist evaluation. So this is a self-assessment of the participants' participation in activities of daily living. They scored it from a 0 to 10. for each of these different tasks. It was modified by removing the pain portion and adding functional activities like using phones, electronic devices, things like that. But other than that, it was about the same. So this is from the PRWE user manual. Okay, so for results. For objective function, this is the Jepsen hand function test, and this is table 2 from the paper. There was no significant difference between the 3D printed and the fiberglass cast during these hand function tests. So showing that at least having the 3D printed cast is not inferior to wearing the fiberglass cast. And however, the paper mentioned that 1/3 of the participants were able to perform tasks within a quote normal time range in a 3D printed cast that they could not do with the fiberglass cast. But it was not really, the difference isn't considered significant for any of these tasks. Oh yeah, and lower number indicates a better result for most of their results. Just to keep that in mind. So the 3D printed cast, for most of the 3D printed cast tasks functions, the participant took less time to demonstrate the task, but not significantly different. Okay, so for patient comfort, so this is more of a subjective finding, but the average patient-rated wrist evaluation function score in the fiberglass group was higher than in the 3D cast group, which indicates that the 3D cast group was assessed to be better, because the lower number means that they preferred that cast. So they also rated the 3D cast higher in comfort, indicated by the lower number, the lower score. And similarly, they rated satisfaction higher with the 3D cast, again, indicated by the lower score. And then for all 3 of these, the p-value was considered significant. So for skin and cast complications, they mentioned a few things. Only one person required cast adjustment with the fiberglass cast, and no one required any adjustment with the 3D printed cast. Skin irritation, 5 with the fiberglass cast, only 1 with the 3D printed cast. And the mean cast wear burden, they rated it moderate in the fiberglass cast versus no hassle in the 3D cast. And then finally, they used the visual analog scale to rate satisfaction again, with 1 being most dissatisfied and 10 being the most satisfied, and they rated 3D printed cast to be to have the most. They were the most satisfied with 3D printed cast. Okay, let's go over the discussion now. So their conclusions were, the 3D printed cast group had trends of functional superiority, but there was the only majorly statistically significant difference was in the subjective patient-reported wrist evaluation portion. Overall, though, they concluded that the 3D printed casts are functionally non-inferior, meaning equal or better, to the traditional fiberglass casting techniques. And they concluded that this makes it an effective alternative because, again, it's waterproof, breathable, and lightweight, which are probably the reasons why participants rated it higher for comfort. Study limitations, so there was a small sample size. There were only 12 participants, so the study may not provide sufficient statistical power to actually detect the subtle differences between the 2 groups. This limits the generalizability of the findings to a broader population. There also may be selection bias since there was no actual medical illness or injury that was actually treated. The study involved only healthy volunteers, which may not represent the population typically requiring immobilization, like patients with fractures or other injuries. So the results may not accurately reflect the experience of real patients who would use these casts. There's also likely a novelty bias, which is a type of response bias, because of the coolness factor of 3D printed technology. Since the participants were unblinded, they may unconsciously rate the 3D printed cast more favorably because it is new and different from what they're used to, regardless of its actual comfort or functionality. And finally, there was only a 2-hour duration of wear, so the study may not accurately capture long-term comfort, durability, skin complications that could arise. So addressing these flaws would involve increasing the sample size, including real patients with relevant conditions, implementing some sort of blinding protocols, and extending the wear period to more accurately evaluate the long-term effects. Now, study strengths. So the study's design includes a direct head-to-head comparison between the fiberglass cast and the 3D printed cast, so you can have an immediate understanding of the differences, and the participants could also directly compare the differences. There were also multiple different outcome measures that aren't always included in like a proof of concept study. This includes objective functionality and subjective comfort, as well as complications. So you get a really comprehensive overview of the effectiveness and the user experience of each cast type. And finally, safety data. So recording the skin complications and the adverse effects like needing a cast adjustment provides an additional layer of analysis on the comfort and long-term suitability for patients. So, take-home message of this is that 3D printed casts have the potential to be a viable patient-preferred alternative in orthopedic care. They may be able to significantly improve the quality of life in patients with orthopedic injuries that might require immobilization, like fractures, or chronic conditions like arthritis or joint deformity that may necessitate both short-term and long-term casting or splinting. These are my references, and that is it. And this is usually time for any questions. However, since I'm just recording this as an example, if you do have any questions about it, feel free to message me. But yeah, that's all. Thank you.